The Copthorne and Millennium Hotel chain lays off hundreds of workers, and the intercity bus company lays off 80 staff and says more job losses are possible. More on that coming up, plus the case of mistaken identity in National's new caucus lineup. But tonight we begin with a COVID-19 vaccine. It's the Everest of medicine, and New Zealand scientists are racing Big Pharma to the top of the mountain. That from Professor Graham Le Gros from the Malaghan Institute. The government's announced $37 million towards a vaccine strategy. That's goal is to source adequate supplies of a safe COVID vaccine at the earliest possible time. $15 million of that is earmarked for overseas research collaborations. $10 million goes to local scientists, and $5 million is to support manufacturing capabilities here. Professor Le Gros heads biomedical research at the Malaghan Institute and is working on a New Zealand-made vaccine. I asked him what difference today's money makes.
It's so important for the country that we have a vaccine strategy. Just think of all the people who've lost their jobs already, and in the future, the potential. The only way we can get our economy and our health and our lifestyle back on track is to have a vaccine so that we can start to operate. So at least this is a strategy that sets out a plan to try and get a vaccine here as soon as possible, either from overseas and even supporting our own homegrown vaccines, because that may end up being the best solution. And also putting investment in production, because you can have all the best vaccines in the world, but unless you can make it, it's not useful, is it?
Exactly. So they have allocated $5 million set aside to support potential manufacturing capability. I mean, is that a realistic amount of money? We're told that these things cost millions, potentially billions.
Of course, but it's ensuring that we actually are starting to think about having that capability and the infrastructure in place. People don't realise that in New Zealand we already have some quite significant infrastructure for producing vaccine, putting it in vials, and clearly this is going to be a long journey, and I don't think the government wants to announce everything, but obviously to make sure that everything's in place for eventual vaccine rollout and production, you need to make sure you've got some, and that's what that'll be for, I'm sure.
Do you see this as a start?
Yes, a start. Thank you. Short answer, yes. I see this as a start in the right direction.
So in terms of your work, how far down the line are you in looking for a vaccine, developing a vaccine?
Well, as soon as we're going for it. As soon as we became aware of the COVID-19 pandemic, we set to work straight away, and we've been beavering away. Now, we didn't rush in and declare we had a vaccine. We still don't quite have a vaccine because we're learning so much about the virus. I think I said it once before. Start late, but finish early. And it's so important because those vaccines that went into people so early on, we didn't really know what we're doing. We didn't know enough about the virus. Now's the time to build a really good vaccine that will work and give long-lasting, safe immunity. And I think we know enough now to do that. And we've got a version. There's a couple of other groups in New Zealand got a version. There's groups in Australia who are actually talking about collaborating with us. So I think the best thing to do is have the best opportunity coming to New Zealand.
When you say you don't quite have one yet, I know people hate to put a timeline on these things, but how far off do you reckon you are?
I say 2 years. I say 2 years with the best will in the world. Just doing the maths around, you've got to check out its safety, you've got to put it into people, you've got to see them mill around, see if they get infected or not. Some things you cannot shorten the time frame on, and that is injecting and waiting for 3 or 4 weeks for the immune response to happen, and then retesting and then testing in lots of people, and then scaling up production. I know overseas some political leaders have talked about before Christmas. Impossible.
You're sure? You're absolutely sure when you say that?
I'm absolutely sure. I would love to believe it, but 2 years, I'm not usually wrong. And if it's earlier, fantastic. But it would take some remarkable breakthrough that we haven't seen yet in our systems and our understanding of how to make a vaccine.
With the greatest of respect, what makes you think that you can do it, given that vaccine for coronavirus hasn't been successful?
Well, we have some really great scientists here who are equal to any overseas. And in fact, the way the whole world's being globalised now, there's no reason to think that New Zealand can't make a vaccine, certainly at the early stages. We've got great scientists, great technologies, and great insight. And actually, we collaborate with the best groups in the world as well. Where the only thing New Zealand lacks is actually the money later on. And I think some of the initiatives the government's announced today, we're linking with CEPI and with Gavi. These are international organisations that ensure that a vaccine development is not restricted by having the money for the later phases of a vaccine program.
As you know, there are, a bunch of other groups who are working on this, racing to get a vaccine. So how does that work? Do you communicate with them? Is it a collaborative, collegial mission, or are you all competing against each other?
It's a mixed bunch of responses, I'm afraid. There's some we're ferociously competing against, and some we're really great collaboration, where we have very open, very trusting discussions about what makes a vaccine. The competitive ones tend to be very commercial. They've gone in early. They've actually restricted knowledge because they're trying to protect their IP. I do suspect that the later ones, the ones that we're involved with, which are trying to build a people's vaccine, that's the best way to think about it. We're really getting access to a lot of knowledge and information around the world, and that's what's going to be required to make a really good vaccine. And commercial people miss out on that knowledge. We get access to it, and we'll build a really great vaccine. So, yeah, you're not insulting me. Of course we don't believe in ourselves. We can do America's Cup, we can play great rugby, we have some of the best IT companies in the world. Why not have the best biotech companies and biotech initiatives? We can do that too, I'm afraid to say.
So is this the Everest of medicine, getting the vaccine?
I think it's that really critical challenge where you're called upon as a scientist. You've been training all your life to know about viruses and know about immunology, how to make vaccine science. I'm an old guy. I've been doing it for 40 years, and now's my time. And my colleagues, we've got a great team of people in Otago, Victoria, ESR, Ag Research. How can we not lose when we've got such a group of people all working together here in New Zealand? And that actually beats many overseas groups, I have to say. The diversity and the intellectual power across the New Zealand science sector is really awesome.
So, Professor, is the real race between you and the likes of commercial companies that the want is for someone who is going to share the recipe, for want of a better word, and to do the right thing by the rest of the world rather than develop it for commercial reasons? Is that who you're really racing against?
Yeah, the real race is commercial versus the people's vaccine. And as long as the human race benefits, we don't care. Sometimes commercial have a real advantage. I used to work in a commercial operation years ago for Ciba-Geigy. They have some real advantage. They have horsepower and power and money. However, they don't quite have the openness and freedom to explore that we have in our sector, in the much more charitable research sector. And we can do some really great things too.
What happens if a commercial company gets there first?
Well, then we'll have to pay them for it under the existing laws, or governments will have to actually regulate just how much money, because often a company will charge what the population or the government can bear. In our case of New Zealand, 5 million people without a vaccine, and no one can travel and no one can come here, we'll have to pay a lot. So let's hope the people's vaccine and our vaccine initiatives work, eh?
So what does the government announcement mean really then?
I think it's a strategy. It's a declared public strategy. It means that unlike some other governments who have just given money to international agencies or said we'll wait for a drug company to make one for us, the New Zealand government signals that it wants to be very intimately involved in the whole vaccine development and acquisition process. It's going to really learn about what's needed, what's safe, what's good. This strategy it wants everything, and it's the start of something very important for New Zealand.
Does it change anything you are doing right now?
Yes. It means that I can pop up and say, hey guys, I'm part of your team, and it means that we can declare ourselves. It means we can engage with the international agencies like CEPI and Gavi and actually help them develop some of those international vaccines which actually do need our help. We've got some technologies here that are not available anywhere else in the world, and I think it's right that we share them too. And we shouldn't forget, we've got to think about how do we roll out a vaccine in the Pacific, how do we roll out a vaccine in New Zealand. 5 million people vaccinated all at once. That's a major thing that's never been done before.
So it puts you at the international table, basically?
Absolutely.
So if someone gets there before you, do you carry on?
Absolutely, because the game is so long. There's so many hoops to go through. When you say get there before me, if someone gets there and actually a vaccine's been rolled out in the people, yes, then we would stop. Although I have to say, what about the next pandemic? I think we've been taught a valuable lesson by COVID-19. There'll be a COVID 2022 or COVID 30. We need to make sure that we have a resilient system that can react much better than we've been able to the next virus pandemic. We know that as we impinge upon the environment, these things are going to happen more and more, or even the COVID-19 may mutate. We need to be able to respond effectively and well, and a vaccine is the only solution.
And that is Professor Graham Le Gros from the Malaghan Institute. He's working on a New Zealand vaccine for COVID-19.